Hemorrhoids commonly will cause protrusion, bulging, itching, and of course bleeding, and sometimes even pain. There is a difference between internal and external hemorrhoids. External hemorrhoids are the ones on the outside. Patients will typically know about them because they typically will have folds or bulges in the skin there. External hemorrhoids are innervated much like the rest of the skin on the body, so that if one were to have a cut or a pinch or a pull at the external hemorrhoid, it hurts very badly. Internal hemorrhoids are further inside of the anal canal. At the level where the internal hemorrhoids live, there are no sharp pain sensation nerves. So if there is a bulge, for example, at the level of the internal hemorrhoids, a patient might have a feeling that they haven't completely emptied their rectum after a bowel movement. When folks come to me complaining of hemorrhoids, I will talk with them about exactly what their symptoms are. I will commonly ask the quality and the frequency of bleeding, as well as whether there is associated incontinence, bulging, or problems with itching or cleanliness. Typically, I will perform an exam in which I will look at the hemorrhoids both on the outside of the anus as well as an anoscopic exam to look at the hemorrhoids on the inside of the anus. For an external hemorrhoid that has thrombosed, depending on the duration of the symptoms and whether the symptoms are improving or not, I will advise a patient to keep the hemorrhoid and suffer through it, or to go ahead and excise it, most commonly in the office. The most common treatment approach for internal hemorrhoids in this country is hemorrhoid banding. This is an office procedure where I place a tiny little rubber band right over the hemorrhoid, causing the blood supply of the hemorrhoid to be cut off, and then in about 4 or 5 days the hemorrhoid actually sloughs off with the bowel movement, and the patient doesn't even usually notice that this has occurred. I will usually offer this treatment to patients first because it is much less painful than operative treatment options for hemorrhoids. Unfortunately, the banding technique does not work on the external hemorrhoids because they're on the outside and do have those sensitive nerves in them that will cause excruciating pain if banded with a hemorrhoid rubber band. The operative hemorrhoidectomy is probably one of the most painful operations on the planet. I encourage patients to try all other measures prior to proceeding with operative hemorrhoidectomy, but some hemorrhoids disease is only going to be fixed with operative treatment. If a patient were to elect to have an operative hemorrhoidectomy, the patient would come into the hospital the same day of the procedure, have the procedure, and then go home that same day. I typically advise patients that if they need an operative hemorrhoidectomy, they are going to be quite sore. They are probably going to not feel like going to work or doing any important activities for at least a week, and they're going to know they had surgery and maybe even still wish they didn't for another couple of weeks after that. I do advise patients that hemorrhoids aren't dangerous, and keeping them and not having a procedure to fix them is typically not life-threatening, but I would caution patients to know that they should not write off anal rectal bleeding as only just their hemorrhoids and not worry about it. It's important to recognize that colon cancer commonly can have that symptom or can even not have symptoms at all.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.